Well, good afternoon, everybody. And thank you very much for allowing me to speak at your second Digital Health Forum. I'm going to share my slides now in order to go through a presentation on our digital journey so far. Could you allow me to share slides, please? Excellent. Can you see my slides?
Yes, very well.
So, as you've just heard, I am delighted to present to you. I'm only sorry that I'm not in the United Arab Emirates. As I look out of the window in Newcastle, it is pouring with rain and horribly cold for the time of year, amongst other reasons. So I have led our digital programs from a medical perspective in Newcastle. And this morning, I wanted to talk to you about our journey using voice to get data into our digital systems and use that in a positive feedback loop to improve patient care as a partnership with 3M and Modal. As I say, I live in the northeast of England. We are a large hospital, 2 sites, and we live in a beautiful part of the world, but we also have very highly deprived areas, and our overall life expectancy is over 2 years shorter than it is in the more prosperous southeast of the UK. We are a high-performing trust and a large one. We have 17,000 staff, around 1,000 consultants, and we provide care to 1.9 million patient contacts a year through around 1,600 beds. We're well developed digitally. We have a comprehensive electronic health record, and as you've heard earlier this morning, we are very much committed to a health information exchange at a regional level, and that's dramatically helped us not only in terms of our day-to-day care, but particularly during the COVID pandemic. Our strategy, our principles for digital transformation have been to absolutely laser focus on patient safety and thereby improve patient experience, improve our ability to conduct real-time research and audit, and through those measures drive organizational efficiency that releases funds to reinvest into our system. As I say, we have a comprehensive digital health record and we no longer record things on paper, but we all know there is more to it than that. It is a hard journey. The problems are that it is difficult, particularly to get doctors to put meaningful data into an electronic patient record. The default is to use it like a digital notepad where people put information in, but it's very difficult then to use. So the challenge is, how do we turn that uncoded data into information that we can use for actionable improvements to patient care? Of course, we have a lot of information that may be available, both from our clinicians, but also from our digital systems, our laboratory management system, our radiology systems. But what we need to do is to use all those data to identify and predict problems so that we can improve our top priority of patient care through actionable feedback to our clinicians. And our strategy is to use artificial intelligence to drive that virtuous circle, starting with the clinician taking their thoughts through voice recognition to data in our EHR, and then through nudging, which I'll explain in a second, produce information that we can then run through an AI engine to produce those actionable insights and advice to our clinicians to improve patient care and safety in real time. So our journey started 5 or 6 years ago as we started moving to digital systems through our document store and signing and creation. But it's really in the last 2 years that this has been turbocharged with the use of voice recognition, getting those data into our system as we are using it. Initially, we have allowed people to use the technologies in flexible ways. Some people used voice recognition to produce a draft that their secretaries finalized for them and then they digitally signed. But increasingly, particularly during the global pandemic, where clinicians have had to be flexible about where and how we work, Increasingly, we are creating our own documents, signing and sending them in real time so that after the patient interaction, that information is available through our health information exchange to all our partners around the region within 2 minutes. And we can dictate, put real data straight into the electronic patient record, not directly necessarily into the EHR, but also into our document production system. And we can use it not only for that, but also for emails between ourselves to provide direct clinical care. So in terms of performance, if I'm honest, we didn't know how long things took before we started this journey. But as you can see, it's dramatically reduced the time to getting that information out. And voice recognition has been the key to improving that to really real-time transfer of data to our partners around the region, thereby improving patient safety. Because if a patient is treated in one organization and then admitted shortly afterwards to another, the barriers to the transfer of that information provide great risks to the patients, particularly during the pandemic. Also driving performance of our clinical teams are the analytics that go along with our voice recognition system. And this shows through different departments where the delays are so that we can focus our efforts on improving performance and giving that feedback to clinicians so that they can see the results of their actions and improving that safety loop. And what have been the real results in our practice over the last 2 years? We've seen multiple episodes of improved clinical safety through the timely transfer of information. As I say, it's dramatically increased our flexibility for clinicians to do clinics from home and remote consultations during the pandemic. And we've seen very significant reductions in the cost of those communications through postage, through plastic tapes, which we used in the past, and through redistribution of secretarial time away from simply typing to much more useful tasks. And we've reduced secretarial overtime very dramatically. And in the long term, we plan to reduce those posts that were largely dedicated to typing and move them, as I say, to much more useful tasks of arranging patient care. Moving now from collecting the information, the data in our system, how do we nudge physicians to improve the quality of that data into information? And the vision is that as a clinician dictates a note into the system, the 3M natural language understanding system marks up the note and points out to us where we may have left gaps and where there are inconsistencies between what we have dictated and what is already recorded in the notes. So in the first instance, we have systems that do that. You then have to go into a separate page in the EHR to document those problems and to complete the list. But the vision is that we will use real-time nudging to analyze what we're saying, compare it with what's in the record, and then put it in the record painlessly. And this is what it looks like. The speech bubble at the top shows my to-do list where I have missed things out and allows me to add that to the problem list seamlessly. And what this looks like in our electronic health record, I can dictate here into the history of presenting complaint. The system points out to me that I haven't specified the details of asthma, heart failure, anemia, and triggers me to do that. It then codes that and tells me how to put that into the problem list, and then seamlessly that goes into the system so that we can use it for those actionable insights and to drive our artificial intelligence. It's not just about identifying patients who need follow-up. The next stage in artificial intelligence is to close that loop and make sure that we're not missing those very important patient interactions that can make a huge difference to safety. We can analyze the information that we've got against national guidelines. We can look at reviewing that with our nurse navigators. all using the power of the natural language understanding to make sure that we're focusing our resources where they will be most effective. So as an example, a radiology investigation is reported. The natural language understanding system identifies what has been requested, and if the report suggests that a follow-up scan is requested in 3 months, it will drive that system through the AHR, through the nurse navigator, to ensure that that patient is followed up in the way that was intended. And this is what it looks like inside an electronic health record. We have a system that can take us through a patient list. It can show us where there appear to be gaps. We can then go in directly into the patient record to ensure that they have the appropriate follow-up, or to adjust the plan based on new information. So it's enabling us to spot the gaps in care that can cause patient safety unintended consequences. So to draw this all together, we have identified a real opportunity using voice recognition and artificial intelligence to produce this virtuous circle that can truly drive patient safety through patient experience and all the other advantages there that we all need out of our healthcare systems to be able to provide the best care to our population. What we need to do now is more of that, ensuring that we are capturing all the data digitally, driving that through artificial intelligence into information and the intelligence that we can use to drive clinical decision support, and coding of our activities and diagnoses, not only for reimbursement, but also to code our outcomes relative to our peers. And we have done that, as I say, very much in partnership with 3M and Modal. And there are huge synergies between our organizations in achieving the best outcomes for patients. I think we need to reassess what electronic health records do in terms of managing results. I think that we have been satisfied with simply endorsing new results, simply ticking a box to say that we have reviewed it. What we need to do is now close that loop, using these artificial intelligence systems to take us straight from the clinician requesting an investigation to ensuring not only that that takes place, but that is acted upon and the patient receives the care that is required. In doing that, in analyzing all our data in real time, we can provide clinically actionable insights about safety through audit, and even more importantly, predict points of care where by intervention at an early stage, we can prevent adverse outcomes, whether that's sepsis, whether that's falls, or any of the other adverse outcomes that we are aware of in hospital care. And in doing that, we are clearly personalizing, we are individualizing that care, not applying a care plan to groups of patients, but looking with granular detail at all the information we hold on a patient, not only in our record, but across our region through health information exchange to provide the best possible care. And through all of that data acquisition and analysis, we can drive what we need to do to improve the future of healthcare through research and audit. And we are doing this currently at a trust level. We are expanding it through our care system across our region and acting nationally to lead this towards the opportunities that we clearly see to use artificial intelligence, starting with voice recognition, but going through that virtuous circle that I've shown you to drive patient care, improve costs, and improve overall outcomes for our healthcare systems. Thank you very much indeed for your attention. I'm very happy to answer questions now, or indeed in the chat or by email afterwards.